Have you noticed a small bubble growing on the back of your wrist? Is it getting to the size that starts to embarrass you in front of others? Sometimes it may interfere with simple things such as putting your watch on or a constant irritation to your friendship bracelets. In some cases, it may even cause pain during some of your favorite activities like yoga and push-ups. This is a ganglion cyst. Today, we will go over the cause, what's inside the cyst, and at the end, how to treat this annoying condition. The cyst is caused by repetitive stress, wear and tear of the wrist joint, with building up of joint fluid and gradual stretching on the joint capsule. Over time, a small opening starts to form, creating a draining channel of the joint fluid. Lastly, the joint fluid continues to drain through this channel, forming a sac of mucus fluid known as ganglion cyst. The most common location of this cyst is at the back of the wrist, which drains from scapholunate ligament. The cyst is close to several tendons and nerves at the wrist, causing irritation when wrist is bent backwards. These are two most common locations of cysts: on the left at the back of the wrist, and on the right at the front where the doctors check your pulse. This patient has a large ganglion cyst in the typical location at the back of the wrist. It is mobile under the skin, and often not painful to touch. The discomfort is from the pressure when bending wrist backwards or from bumping into things. Although tempting, it's not recommended to stick sharp objects into it or hit with a holy Bible. These treatments not only causes significant pain, but also carry a high risk of injury to tendon, vessels, and infection. Ganglion cyst can be helped with these two treatment options. Firstly, a guided aspiration under ultrasound, and secondly, to remove it through surgery. Under local anesthetics, the ultrasound scan is first used to confirm the location of the cyst. A fine needle is then introduced under the scanner to precisely place the needle tip within the cyst, and the doctor aspirate the cyst dry. Sometimes cortisone injection is also introduced to help reduce pain and inflammation. This treatment is an effective way to deflate the cyst without a long recovery, but the cyst can come back in 50% of the cases. To effectively stop the cyst from coming back, the feeding channel of the cyst can be removed with surgery. Ganglion cyst surgery typically takes half an hour to an hour, with expected recovery of 4 to 6 weeks. This significantly reduces the risk of cyst coming back, but with potential problems such as stiffness of the wrist. I hope you find this video useful. Please leave your comments and questions below.